Welcome to This Explainer. Okay, right off the bat, I want you to do something with me. Just swallow once. Just that one time. Do you notice what you're feeling at the very back of your throat? Is there something sitting there, kind of a thickness or a persistent coating that just will not go away no matter how many times you try to clear your throat today? First, maybe it was just in the mornings, then it slowly crept into your whole day, and now you're basically carrying a water bottle everywhere you go. Well, today we're decoding your body's hidden signals because I promise you that feeling is not random. So ask yourself this, is that throat mucus worse right when you wake up, or is it literally an all-day event? Your answer to this actually tells us a lot about what's driving this whole process in your body. And I really want to validate the frustration you're probably feeling right now. I know so many people who are just handed cough drops or told to, just drink more water, and their concerns are completely dismissed. They're told it's just getting older, but it isn't. Every persistent symptom is your body's way of communicating something incredibly specific. So today we're going to decode exactly what those signals mean. Here is our diagnostic roadmap for today. We'll start with the persistent mucus mystery, then move to silent reflux and sinuses, followed by medications and dehydration, explore the gut-lung connection, touch on medical red flags, and end with your daily action plan. Part 1. The persistent mucus mystery, understanding your aging airways. Okay, so your body makes mucus constantly to protect your airways, right? And honestly, that's a perfectly healthy process. But we need to talk about something called mucociliary clearance. Your airways are literally lined with millions of these microscopic hair-like cilia. In a younger adult, this three-dimensional sweeping system is super fast, clearing mucus almost instantly. But as we age, studies confirm that these cilia naturally slow down. They beat less frequently. So here's the absolute crucial takeaway. Mucus that would have been completely cleared out in seconds at age 40, it now pools and accumulates for hours. This is the physiological foundation for everything we're going to talk about today. Section 2. Silent reflux and sinuses, the hidden local culprits. Let's look at laryngopharyngeal reflux, which is more commonly known as silent reflux. On the left, you're seeing a healthy, tightly closed stomach valve, but on the right, an aging valve. As we get older, this valve loses its tone. It's kind of like a stretched out rubber band. It just doesn't close all the way, which allows stomach acid to creep upward into the throat, especially when you're sleeping at night. Now, your delicate throat tissue absolutely cannot handle stomach acid. So what does your body do? It panics and rushes to produce this incredibly thick mucus to coat and protect that irritated tissue. And the wildest part of all of this, it happens completely silently. There's no heartburn, no chest burning, just a throat that will not settle down, leaving you with that heavy, gross mucus feeling every single morning. Oh, and a quick side note from the research. If you're regularly taking anti-inflammatory meds like ibuprofen, they actually reduce your stomach protection, making the silent reflux significantly more likely. So let's move to our second cause, which strikes from above, postnasal drip. Now, we aren't talking about some massive, painful sinus infection here. We're talking about mild, almost invisible sinus inflammation. It drains steadily and silently down the back of your throat all day long. And research shows the average patient dealing with this is exactly 55 years old. Now, here is the huge trap that so many people fall into. You take an over-the-counter antihistamine because you think, hey, it's just seasonal allergies. But those antihistamines, they just dry out the mucus temporarily without actually fixing the underlying inflammation. So you're left with this dried out, thickened mucus stuck right at the back of your throat, which feels significantly worse than before. Section 3. Medications and dehydration. Systemic surprises. 53%. That is a massive statistic. A huge study of over 27,000 patients actually found that adults over 65 have a 53% higher odds of experiencing throat irritation and mucus buildup. And why? Because of a very specific side effect of ACE inhibitor blood pressure medications. Now, ACE inhibitors are incredibly common, and they're effective, but they allow a substance called bradykinin to build up in the body. For about 5 to 20% of people taking them, this triggers a persistent throat irritation. And because this specific side effect can literally take months to show up after you start the medication, almost no one connects the little pill they take to their constant throat clearing. Okay, think about the fresh, fluid maple syrup on the left versus that sticky, thick overnight syrup on the right. Your mucus behaves exactly the same way, depending on your hydration levels. Now, don't worry, this isn't just another simple drink more water lecture. The research clearly shows that as we age, our natural thirst mechanism actually becomes significantly blunted, meaning you can be meaningfully dehydrated without feeling thirsty at all. If you're waiting around until you feel thirsty, you're already way behind. And that chronic, mild dehydration turns your normally thin, clear mucus into that thick, sticky overnight maple syrup that is just impossible to clear out. Section 4. The gut-lung connection. The surprising root cause. Let's talk about dysbiosis. The health of your gut microbiome actually directly influences how reactive your upper airways are. When your gut bacteria gets disrupted, say from a low-fiber diet, repeated rounds of antibiotics, high sugar, or even chronic stress, it creates what we call dysbiosis. The really fascinating science here involves the gut-lung axis. Your gut actually sends inflammatory signals straight through your immune and nervous systems, directly commanding your respiratory system to overproduce mucus. So there might be absolutely nothing physically wrong with your throat itself. It's simply responding to these internal SOS signals coming all the way from your disrupted gut. Section 5, Medical Red Flags. When to see a doctor. Listen, this part is absolutely crucial. If your mucus is consistently tinged with blood, if you are experiencing progressive difficulty swallowing, unexplained weight loss, a persistent lump in your neck, or significant voice changes that just do not improve, please do not attempt to self-manage this. These are clear red flags. They go way beyond the scope of a daily annoyance, and they require prompt evaluation by a medical professional. Section 6, Your Daily Action Plan. Practical Steps for Relief. Let's translate all of this into a real, practical evening routine to combat that silent reflux and overnight dehydration. Step 1, stop eating 3 full hours before you go to bed. Remember that aging stomach valve we talked about? When you lie down right after a meal, it has a terrible time staying closed. Step 2, elevate the head of your bed using a firm wedge under the mattress. Not just piling up pillows that bend your neck, we want to actually use gravity to our advantage to keep the acid down where it belongs. And step 3, drink a full glass of warm water right before you go to sleep to support that overnight hydration and keep the mucus thin. And then, boom, your morning routine. First thing, drink 1 to 2 glasses of plain warm water immediately after waking up. This instantly loosens up that overnight accumulation before it has a chance to ruin your day. Next, perform a daily warm saline nasal rinse. Why? Because this physical high-volume saline rinse actually physically removes inflammatory mucus. And get this, it improves the function of those little sweeping cilia we talked about at the very beginning of the explainer. And step 3, you've got to maintain consistency for at least 2 weeks. Doing it once gives you 1 day of relief, but making it a daily practice, that gives you cumulative, life-changing improvement. All right, for the long game, and to bust a few internet myths while we're at it. First, if you take an ACE inhibitor, maybe bring your symptom timeline to your doctor and just ask if an ARB medication might be a better fit for you. Second, to address that gut-lung axis, try adding a daily serving of fermented foods like kefir or kimchi to really diversify your gut microbiome. Now let's bust those myths. Honey, look, it's great for temporarily soothing your throat for sure, but it's not going to cure any of the 5 root causes we just discussed. And apple cider vinegar? I know it's wildly popular online right now as a cure-all, but if you have silent reflux, introducing even more acid into your system is going to severely worsen the problem. Definitely avoid it. I really want to leave you with this thought today. You are not just aging, you are dealing with specific, identifiable, addressable physiology. If anyone has ever brushed off your frustrating throat clearing as just a normal part of getting old, they were flat out wrong. You are empowered now with the actual biological facts. This is completely manageable. So as we wrap up this explainer, I gotta ask, which of these 5 hidden causes, silent reflux, postnasal drip, ACE inhibitors, blunted hydration, or the gut-lung connection, surprised you the most? And honestly, more importantly, which step from our action plan are you going to implement tonight? The knowledge is yours now. It's time to clear things up.